Trauma-informed care. The facility must ensure that residents who are trauma survivors receive culturally competent, trauma-informed care in accordance with professional standards of practice in accounting for residents' experiences and preferences in order to eliminate or mitigate triggers that may cause re-traumatization of the resident. Patient endorsed or family chart indicate a history of past trauma experience which may place the resident at risk for unintentional re-traumatization and negative emotional, physical, cognitive, behavioral reactions, such as experiencing feeling anxious or fearful, avoidance of activities and social supports, refusal of care, ADLs, physical, occupational therapy, irritability, anger, increased depression, anxiety, sleep disturbance, appetite disturbance, increased fatigue, or negative reverbalization. Residents who have a history of a trauma and or PTSD, which is post-traumatic stress disorder, must receive appropriate person-centered and individualized treatment and services to meet their assessed needs. There are screening tools such as questionnaires, assessments, checklists, etc., to ensure proper information is collected in order to care for these residents appropriately. Acute trauma versus chronic trauma. Acute, weeks to month. They can be adaptive, keeps person vigilant and reactive to danger. However, resolves as safe environment is established. Chronic, extended period to long life affliction trauma. That's maladaptive, stress response to everyday events, alters daily patterns, maladaptive coping responses, and persistent symptoms such as flashbacks, physical and emotional symptoms, avoidance of fear, and isolation becomes frequent experience for them. PTSD is not exclusively a consequence of combat or war zone exposure. Individuals who have been physically or sexually assaulted who have experienced a terrorist attack or natural disaster, among other things, may also be affected by PTSD. Some older nursing home residents may have lived through a time of genocide and witnessed or been subjected to the intentional and systematic destruction of a racial, political, or cultural group, such as that which occurred during the Holocaust in World War II. Being admitted to a SNF can cause worsening or reemergence of symptoms and can trigger memories of traumatic events, and coping with these memories may be more difficult for older adults due to the structured environment. PTSD symptoms can change with age. They can change in roles, functional loss, cognitive decline, environmental changes, and failure of existing coping strategies. Care planning, signs and symptoms. History of trauma, PTSD, they have distrust, fear, they're depressed, have anxiety, aggression, angry outbursts, tearfulness, agitation, trembling, cowering, panic attacks, withdrawal from social interaction, and changes in sleep pattern. PTSD, re-experiencing, reliving the event. They can have emotional behavioral expressions of distress. They have outbursts, irritability, discontent, inability to experience pleasure and dissociation, hyperarousal, increased startle response, and difficulty sleeping. Care plan interventions. PTSD is associated with anxiety. So utilize aerobic and non-aerobic exercise, meditation, yoga, progressive muscle relaxation, antidepressants, psychological services, and minimize or eliminate triggers. Be aware of your tone of voice and body language. An approach should be calm and direct. Monitor and provide ongoing assessment as to whether the care approaches are meeting the emotional and psychosocial needs of the residents, along with reviewing and revising their care plans. One example of past trauma events can be the Korean War veteran, Army, infantry, or direct combat exposure. Triggers can be loud, unexpected noises of unknown origin. Symptoms and behaviors can be persistent yelling and anxiousness. Our interventions prevent loud noises, utilize noise reducing, blocking devices, so put on a television or a radio, a white noise machine, give them earplugs, place resident where they visually see the cause of the noise, and prepare the resident in advance that loud noises will be occurring. Coping skills, you can offer them drinking coffee, sitting outside, watching television, or just listening to music. Staff responses and care approaches. Explain the cause of the noise and show them. Approach in a calm manner. Allow resident to express their feelings. Offer noise canceling options such as headphones, earplugs, TV. Offer a quiet place. Encourage relaxation techniques. Provide support and reassurance of safety and security. And offer interventions and activities to increase sense of control. Also, we have social service referrals, psychological services, and psychiatric support services to offer. Another example of past trauma events can be past sexual assault or abuse. Triggers can be unannounced, unexplained, touching during care activities, staff treatment providers touching residents without permission, residents feeling there is an insufficient privacy during ADL care and treatment procedures, disrobing for medical treatments, receiving physical exams by male providers so that same sex as perpetrator abuse. Symptoms and behavior. Residents refusing certain care procedures and treatments. Increased anxiety. The resident report of increased somatic symptoms, which can be pain or fatigue, increased heart rate, shortness of breath, and once again, increased irritability. So what are our interventions? As available, use your female direct care staff and rehabilitation staff. Ask permission to provide or begin care for ADL care and medical treatments. Encourage and allow resident to provide self-care and hygiene care as much as functionally physically able. And always use that hand over hand. Offer window, side of room, or increased privacy. Coping skills, guided breathing, mindful meditation, prayer. Distraction, watching television, especially game shows, and reading the newspaper. Staff responses and care approaches, reorient to activity care procedure, explain care procedure step by step, approach in a calm manner, allow resident to express feelings, offer a quiet and private place to calm down, encourage relaxation techniques and activities to increase sense of control. And once again, we have the social service referral, psychological support services as indicated, and psychiatric services as indicated. Any questions? We will now go on to the test. True or false? Anyone can experience a traumatic event. Number 2. Types of traumatic events include A. Physical sexual abuse, B. Natural disasters, C. War and historical traumas, D. Accidents and injuries, E. Significant losses, F. All of the above. 3. True or false? Being transferred to a skilled nursing facility in and of itself does not constitute a potentially traumatic event. 4. PTSD stands for Physical Therapy for Speech Disorders, Person-Centered Treatment for Sickness and Disability, C. Post-Traumatic Stress Disorder, D. Psychologically treatment for symptoms of depression. Question number 5. Core principles of trauma-informed care include A. Safety and security, B. Trustworthiness and dependability, C. Fostering collaboration and sense of empowerment, D. All of the above. 6. True or false? Re-traumatization refers to the process of re-experiencing traumatic stress as a result of a current situation that mirrors or replicates in some way the prior traumatic experiences. Number 7. Examples of potential re-traumatization triggers include A, loud noise, B, supporting sense of privacy, C, casual touches, D, offering choices, E, A and C, F, none of the above. Question number 8, true or false? Trauma-informed care plans should be person-centered and idealized. Question number 9, staff can support trauma-informed care by A, learning a resident's history and life story, B, preventing trauma triggers and unintentional re-traumatization, C, approaching all residents in the same way, D, all of the above, E, A and B, F, C only. Last question, number 10. Trauma can negatively impact a person's A, emotions, B, physical health, C, cognition, D, behaviors, E, all of the above. Thank you.